Regarding TIS-102, it's very exciting that we now have some more third-line options available for patients, and we have found that the agent, patients seem to tolerate the therapy pretty well. There definitely is some issues more concerning with cytopenias, so anemia. Sometimes patients require blood transfusions, nausea. I would say this week alone, for whatever reason, there was like a surge of nausea with patients on the TIS-102, but controllable with antiemetics. And again, the cytopenias so far seem to be manageable if we had to give them a blood transfusion. I would say probably one of the more challenging aspects of it is the scheduling. The dosing is a little different than some of the other agents that we give, where they have to take the medicine from days 1 through 4 and 8 through 12. So it's kind of broken up a little bit. So I would say a big part of my job is making sure that they're aware of the proper dosing on how to utilize the medicine. Regarding regorafenib, this is also another nice, that we have a third-line option for patients. Its more challenging side effects would be skin changes. It can also be associated with some high blood pressure, things that we often have to work, again, with their other physicians or their primary care physicians regarding management of high blood pressure, or if they're experiencing any skin changes, making sure that they're using proper creams and things at home. Sometimes regorafenib can also be associated with some hand-foot changes. So again, making sure that they are aware of what appropriate creams to use to reduce the symptoms or prevent the symptoms, in fact, and also ways to prevent this hand-foot syndrome from developing, avoiding prolonged pressure to areas for women not wearing, potentially high heels. There's often specific aspects of their occupation, whether it be somebody that might be for instance, I had a patient that was a driver, like a truck driver, so the constant clenching of the wheel, that constant pressure on his hand put him at a little more risk for hand-foot syndrome. So just making them aware of those kind of things and how to manage them.